Well, the wildfire pollution in Canada and Northeast U.S. is affecting the health of so many people right now. I'm joined by our medical expert, Dr. David Winter from Baylor Scott and White Health, to discuss the hazards of air pollution and how it can impact our health. Good morning, Dr. Winter. How are you feeling?
Good morning. I'm fine. Anxious to talk about this, so it's a big problem right now, Damon.
It sure is. You know, Dr. Winter, how bad is the air pollution in that part of our hemisphere right now?
Yeah, it's really bad. If you don't have to travel up there, don't go right now. But I'll tell you, our bodies are designed to filter out these particles. The nose hairs can help filter them out. I've got a model of the back of the nose. There are these folds here called turbinates. Those can trap particles. The problem is smoke and soot have really tiny particles, allows them to bypass that. With this model here, go down the windpipe, get into the lungs and down to the very base of the lungs where they trap the alveoli. That's where oxygen is absorbed and goes into the circulation. With the blockage there, you can't do that very well. So this is a serious problem for a lot of people right now.
Yeah, you know, we've been hearing so many stories, Dr. Winter. So who are most vulnerable to the effects of air pollution?
Yeah, the very, very young, because they have smaller airways, you can get plugged more easily. The very old, because their chest muscles are not as strong. Our muscles actually pull the lungs out, help us breathe. So with weaker muscles, you can't breathe as well. Of course, asthmatics, folks with chronic lung disease, heart conditions, all those folks are particularly vulnerable to pollution such as we're seeing up there in the Northeast.
You know, Dr. Winter, I have some friends over on the East Coast, and we were talking about the air pollution right now. Many of them are debating if they go outside whether to wear masks. I talked to some friends in D.C., even New York, and even down in Raleigh, North Carolina. So what about masks? Can they help filter out smoke particles?
Yeah, they can, Damon, but the old cloth masks, these don't work very well at all with the smoke particles. Now, surgical masks help a little bit, but the best are the K95 or the N95 masks. These work very well, particularly if you put them very tightly up around your face, make sure there's no leakage around the sides. Of course, the best thing to do, we're never out with pollution like that, is just stay indoors.
I guess that makes sense. So stay inside when the air outside is bad. Should our viewers find themselves in air that is heavily polluted, what do you recommend that they do?
Well, in addition to staying indoors, if your air conditioner is pulling air from the outside, make sure your filters are clean. The HEPA filters, HEPA, those are the best ones that work indoors. Keeping fans circulating, you just heard that, that can make a difference. And here's an important thing for you people that are trying to be healthy: do not exercise outdoors when there's pollution out there. You just bring more particles in there. Exercise indoors or put it off for a while, because those particles get down in the lungs and they can actually cause some damage.
Dr. Winter, always appreciate your advice and perspective. Thanks so much for joining us today. We appreciate you.
Thank you, Damon. Thank you.